Well, good morning, everyone. Welcome to today's Gentle Movement at Home. We're great to see you here. Great to see some familiar faces, or not faces, but names in the participant list. So thank you for coming. Just before we start, I just want to let everyone know that today's session is going to be a floor session. So you're going to be lying down and sitting on the floor for some of these exercises. You'll probably be more comfortable if you have a mat, a yoga mat if you have it, or a towel or something like that, something you can lie on, as well as a pillow and a blanket. So if you want to just take a few minutes and get that equipment before we start, I think that would be great. Otherwise, I'll just do my very quick little intro here. So I'm Jen Hansen. I work at Pain BC as the Director of Education, and I'm joined today by our friend Neil Pearson, physiotherapist and therapeutic yoga instructor. This is the 9th session we've done in the Gentle Movement at Home series. Basically, what you need to know is this is being recorded. It is broadcasting live on Facebook right now, and then you'll be able to find the videos in our Facebook video list. We also have a YouTube channel, and it's being recorded there, so you can send it to your family and friends after. If you have any issues during the session, please email education@painbc.ca or put your question in the chat. Neil and I usually have a little bit of time at the end to answer any questions that you might have that come up during the session, so we're happy to do that. And then we just ask for you to stick around at the end and just do our very quick poll so we can understand a little bit more about what you thought of this session. Just a reminder, we've got 2 more sessions this week. We've got one on April 29th at 12 with Allison Ezet, who's a physiotherapist. Neil's back again on Thursday, April 30th at 1, and then next week we've got Neil coming again on Tuesday. I think that is all for my announcements. So Neil, I will hand it to you.
Great. Thanks, Jen, and thanks again to Pain BC for setting this up and letting us offer these classes. So if you've been here before, you know that we're going to do a little bit of gentle movement and some relaxation. And so part of that, I'm sure you've experienced before, if you're new to it, is to bring our attention inward and pay attention to what's happening within us, and use the things that we notice about what's happening inside us as a guide for how much to move, how long to do a movement. And so as we go through the session today, what I'll be doing is asking you to notice what's happening to your breath, notice what's happening to your body tension. I'll be guiding you to pause anytime you want to pause, and please do that. I know that often if we're doing movement in a class and everyone else continues to move, we don't feel all that great about stopping, but here, of course, please do. For whatever reason, if you want to stop, if you need to stop, even if it's a breathing technique or an awareness technique, please go ahead and do that. So I'm sitting, but and you're welcome to sit to start with this, or if you'd like to, you could start from laying down. So if you're laying down on your back, you may need to have a pillow underneath your head. I'll put the pillow that I'm sitting on. I'm going to use that when I lay down after a bit. But I'll just guide you a little bit to start with here. So if you are laying down, you can have a pillow behind your head. You could have your knees bent and your feet flat on the floor, or you can have your legs straight out on the floor. If you do that, most people like that. The towel that Jen mentioned, you could fold or roll the towel and just put it underneath the back of your knees, so your knees are just a little bit bent. Often that just lets us relax a little bit better. If by chance, for whatever's going on with you, laying on your back doesn't feel like the right thing to do, you certainly can lay on your side, lay on your belly, or come to a seated position. And as with all of these sessions, if we're doing something and it doesn't feel like it's safe, one of the things you could do is pause, get yourself into a place where you do feel like you're safe and you do feel like you're not going to leave this provoked. One of the options you have would be to imagine the movement, to see if you can imagine what it would look like when you do, if you were to do that movement, or imagine what it would feel like if you do that. So with that, if you're imagining what it feels like, part of what we want you to do is to imagine that you can do it with more ease. Imagine doing it with less pain, maybe. All right, so if you're laying down, great. If you're sitting, great. Wherever you are, just find a comfortable spot and just bring your attention to your breath. So if you can, for right now, let your breath just go. There's no need to control it. There's no need to change it. Now I'm telling you, there's no need to, but if you want to, it's perfectly fine. Go ahead and change it if you want to, and then see if you can sort of take your attention to that place where you can watch your breath. It's almost like you're witnessing your breath happening without having to try to change what's happening there. And as I said, if there's something you want to change, feel free to change it if you want to, but also explore the idea of, even if there's something there you think you might want to change, what would happen if you don't? So you can play with this and be curious around this while you're doing this. So you're watching your breath. You're feeling the air as it comes in. You're feeling the air as it goes out. Maybe you can feel it around the rim of your nostrils. Maybe you can feel it back in your nose, in your nose or the back of your throat. You probably can feel some movement of your body as you breathe in, your ribs moving, your belly moving, your chest moving. Notice if there's movement on the back of your body as well as the front. If you're laying down, you'll probably feel much more on the front just because of the weight of your body on your back. But maybe you can still feel your ribs moving at the back of your body. And you can notice how long it takes to breathe in. And you can notice that little pause or change of direction when you finish the inhale and start to head into the exhale. Just notice what happens there. Maybe it pauses for you, or maybe you sort of go in this nice smooth transition from one to the other. Same as at the end of the exhale as you move into the inhale. What sort of happens there as you change direction or move from one to the other? Just doing your best to be curious and notice. And remember, even with this, if you want to pause, if you lose your breath even doing this, just pause, catch your breath again, and come on back. Now, as we go through the movement practice, I'll ask you at times to notice your breath. So this is sort of the process to do. But for now, what I want you to do is shift from noticing your breath to changing your breath or regulating your breath. At this point, what I'd like you to do is to create a sensation that the back of your throat, at the soft palate at the back of your throat, that is releasing up towards your forehead or towards the crown of your head. So with this breathing practice, we're going to try to gently increase the space at the back of the throat. So at the same time as you feel the soft palate releasing up towards the crown of your head, take your awareness to your tongue and feel the sensation of your tongue just sort of softening down towards your heart. It's almost like that space at the back of your throat is getting bigger. Soft palate is releasing up, base of your tongue is softening and releasing down. So you're not pulling it down, you're just feeling a little bit of less effort back there. Now at the same time as you do this, as you breathe in, feel the swirling of the air in that space at the back of your throat. Whether you're breathing in through your nose or through your mouth, as you breathe in, feel the air moving or swirling at the back of your throat on the way in. See if you can feel it as you breathe out again. It's just a gentle sensation of movement of air, like there's more space back there. Now this feels like enough. Stay with this. If you want to add one more piece, sometimes people like to have the feeling it's almost like their eardrums are sinking in towards the back of their throat as well. So if you're doing all of it, you're feeling your tongue soften down a bit, you're feeling your soft palate release up, you're feeling your eardrums sink in towards that same place. So there's a bit of a bigger space back there. And you can feel the air swirling as you breathe in, and the air swirling there as you breathe out. And maybe even as you do this, you can hear your breath a bit more. So don't try to force the sound. Just see if you can hear your breath when you're breathing that way. As with all the practices, if you lose your breath or you want to stop for any reason, go ahead and do it. So I'm going to ask you to stay with that breath. So you're still in that laying down position or seated position. Stay with that feeling of the air swirling at the back of your throat, that little bit of a bigger space on the way in and on the way out. And while you're doing that, divide your attention so you can feel that breath and you can feel the sensations of your body. Just scan through your body as you're breathing that way. Feel your feet and your legs and your thighs and your hips and your pelvis and your spine and your torso and your neck and your arms and hands and head and face. Dividing your attention between the sensations that you feel in those parts of your body and the breath that you're working on. As you continue with that breath, take your attention back to your hands for just a moment. Curl your fingers into your hands and your palms and just gently squeeze a small amount. Find that just right amount of effort, like a small effort, like you're just holding on just a little bit. You can feel the muscles of your hands contracting a little, and then just let go. Stay with that breath. Feel that sensation of the air swirling at the back of your throat. And then for 3 breaths, curl your fingers in again and hold that tension gently. Divide your attention between your breaths as you breathe in and out, and the gentle sense of tension in your hands. Now, at the end of that 3rd breath, let your hands go. Keep your attention divided between your breath and your hands. Feel the sensation of less effort in your hands now. Muscles relaxed. Now stay with that breath and do the same thing with your hands and your forearms and your upper arms all together. So create a little bit of tension in your hands, forearms, upper arms, even in your shoulders, just a bit. Hold that. Around 3 breaths. If 1's enough, stay with 1. If 2's enough, stay with 2. If 3 is good, stay with 3. And at the end of that 3rd breath, let your tension release. Stay with the breath though. Keep that breath flowing. Swirling of the air, the gentle sound of the breath, the back of your throat. Now, if you're seated, this might be a little bit harder to do the next part. If you're laying down, it's a bit easier. This time, as you continue with that breath, you're going to hold a little bit of tension in your feet and your calves and your thighs, just a bit. Try not to get too much effort in the rest of your body as you do it. You can still feel and hear the breath swirling at the back of your throat. And at the end of that 3rd breath, end of that 3rd exhale, release that tension in your feet and calves and thighs. Remember, you can pause, you can stop, you can shift anytime you want to. If you feel all right, stay with the breath. And we'll add in the torso this time, a little bit of tension. So just engage the muscles around your belly and your ribs and your chest and your upper back just a bit. Hold it while you continue with that breath. It's gentle effort. The just right amount that you feel just some effort of those muscles. And you can still feel your breath coming in and your breath going out at the same time. Continuing to do your best to divide your attention. If you've held for that 3 breaths, that time is probably up, so let that go. Let the tension go around your torso again. I'll just try one more effort like this. So you're going to find the effort of the muscles of your neck, muscles around your forehead and the back of your head, and muscles around your face. So keep that gentle swirling of the breath, the sound of it, the feeling of it, as you gently engage the muscles around your neck, muscles through your head, to hold your scalp and move it around, muscles around your forehead and eyes and cheeks and jaw. Just a little bit of effort. So you can still feel the breath flowing in and out. So maybe if you're holding too much effort, you can't feel your breath and you need to back off the effort a bit. At the end of that next exhale, just let that go. And now let the breath pattern go. If you want to move around, if you're seated, move around. Maybe you want to take your legs out in front of you and give them a bit of a shake around, or make your way down your back. So if you're down your back, move around a little bit. I'm going to take this pillow to here. put on down here, and this is something we'll be asking your feedback for, is how it shows up with the camera at this angle and me laying down like this. So I'm going to start in laying down in this position with my knees bent, my feet flat on the floor, my back relaxed. I'm just going to let my hands rest on my ribs, but I could lay them down on the floor here. And once I'm here, I just want to release that tension. So there would have been tension in your muscles from sitting up if you're doing that. If you were laying down, just go through your body and notice spots. If there's tension, just let it go a bit. So you can let muscle tension go by using your breath. You can let muscle tension go by using your mind. You can let muscle tension go by taking your awareness to an area of your body. Sometimes that, just take your awareness there and send a message that it's okay to let go. So once you feel that calming of the muscle tension as best as you can, come back to the breath again. So that sensation of the breath coming in, swirling around at the back of your throat, maybe the feeling of it there as well. And we're going to start some really gentle movements. So the first movement, bend your left knee up. If you can, take a hold of the back of your thigh and just hold here. So just gently hold your leg so you're not using too much effort. And from here, just start circling your ankle around. You can pick whatever direction you want to go. And so in or out, but just circle the ankle around. While you do it, keep the breath flowing though. Slow, easy inhale and exhale, feeling that air swirling around at the back of your throat. And then let that leg down, and we'll do the same thing on the other side. So bring the other leg up, just hold on to the back of the thigh. Relax your shoulders a bit. Don't get too tense in your hands or your leg, and then just start circling that ankle around. Now, if you run into any pain or tension or discomfort with this, it's okay to go to the edge. You can just move your ankle to a spot where you feel like, yeah, that's a spot where I can feel it a bit, but I know I'm okay. So you want to find that just right spot here. Keep your breath calm, keep your body calm. If you are running into the edge of the pain, sometimes you can feel everything tensing up, and try to let it relax. And then let your leg go back down again. Now remember this though, you don't have to wait for me to stop doing the movement. If it's time to stop, if your body is saying that's enough, then we'll just pause. Go back over to the other leg again. This time, bring the leg up, hold on to the back of the leg. I'm just intertwining my fingers behind my leg like this. So let my shoulders relax again, let my leg relax a little bit, and this time just straighten your knee up. So just take your knee up, your leg up. Now maybe it only goes that far, and that's fine. It doesn't have to go straight. If it does, that's great too. Just take your leg up to that spot where you feel like that's enough, and then come on back down again. And part of the thing about feeling is that enough is to come back and feel like, does it feel safe? Do I feel like I'll be okay if I keep doing this? Can I keep my breath calm? Can I keep my body tension low as I do this? And then let that leg go. If you're still moving, put the foot back down on the floor. Try the same thing on the other side. So hold on to the back of the leg, let your shoulders relax, release some of the tension, and then just straighten your leg only as far as you want to, or as far as you feel like that's where it starts to feel like, I'm not sure if it will be okay if I keep on forcing it. Or maybe you can shake your leg right up tall. Just do whatever feels right for you today. Do the amount of movement. It's easy to smile. You can keep that breath flowing so you can still feel and hear that sensation of air swirling up the back of your throat as you do this. And then let your leg come on back down to the floor. If you want to shift your hips around anytime you want to, straighten your legs out, do any movement, go ahead. Remember, the best thing to do is to listen to what's happening in your body. And if you feel things start to get tense, if your mind is getting tense or anxious, if your body is tightening up, if your breath is getting tight, that's probably a good idea. Just pause for a moment, move around just a little bit, or just relax. So this time what I'm going to get you to do is to bring your knee up. This time you hold on to the knee or down to the shin if you want to. And the idea here is to pull your knee in towards your chest and then release it. You can let it go all the way down to the floor if you'd like. And you can, when you bring your knee in, you can let it go just to here. So you get to choose. If you're not sure, try one, then try the other and see which one feels like it's the best thing to do. But you're probably feeling a bit of a stretch when you do this, a little bit of tightness around the hip. Keep that breath flowing as best as you can. And do the other side. Find that just right hold on the thigh. Relax your shoulders a bit. Keep your breath flowing. You can still hear and feel that sensation of the air just swirling in that little bit of extra space at the back of your throat. If your tongue starts to get tense, let it release again. If it feels like the soft palate is drawing down, see if you can let it release up towards the top of your head. Come back to that sensation of letting your eardrums sink in towards each other or in towards the back of your throat. And then let that knee come on back down again. So this time, shift your position a bit. You're going to take your feet and put them a little bit wider than your hips, if that's all right. And so your knees go a little bit wider. Let your arms rest on the floor if you're feeling okay with that. And then just let your knees roll down to the side, however far feels okay. And then down to the other side. So you can let your legs come out and roll them back and forth this way if that feels all right. Or if having your knees up like this doesn't feel okay, you can take your legs out. Remember, you can move them just a bit one side, just a bit the other side. You don't have to take them all the way down to the floor. Now, if this feels good and you want some more, what you can do is as your knees go one way, you can turn your head the opposite way. Try that out and it doesn't feel like the right thing to do. Come back to the knees or come back to just pausing. So once you get back to the middle again, just move your hips around a little bit. You can take your legs straight, roll them around a little bit if you want to or need to. Then have your knees bent once again. This time you're going to bring your knees back up. Put your hands on top of your knees if that feels okay, and circle your knees around over top of your hips. So I picked this direction, but you could have picked the other direction, that's fine. And you can do small movements if that feels like the best thing to do, or you can work on doing them even bigger. But try to get the movement smooth and get your breath smooth while you're doing this. You have to pay attention to what's happening in your body. So if there's any pain or tension or discomfort, don't go crashing through it. There's no need to do that. Just go to that just right spot where maybe you feel just a little bit. But you have this feeling that you'll be all right, or this sense that you'll be all right. Now, if you want to, you can go back around the other way. If that feels good and go the other direction, do that. And then when you come back to the middle next time, just hold onto your knees and pull them on up towards your chest just a little bit. If it feels okay to bring your chin up, then bring your chin up. Let your head come back down. Let one leg come down, then let the other leg come down. Put your arms at your side and either pause here with your legs bent or take your legs back out straight again, whichever would feel better. If your legs are straight, you can have that pillow underneath your knees. And just let your breath go and let your body relax again. Create a sensation that your body is sinking down towards the floor a bit. Like your legs are getting a little bit heavier into the floor. Your thighs and your hips, pelvis are sinking down just a bit. Your torso is relaxing down, getting a bit heavier. Shoulders are heavier. Arms are sinking heavier, and even your neck and head are. The idea of creating that sense of heaviness is to release some of the tension in the muscles, to take a bit of a break. Now, if there's any stretch you want to do, if you feel like it would feel good to lift your arms up or take them out to the side or do a twist again, go ahead and do that. If you're okay here, you can pause right here, or if you would feel better doing it, bend your knees back up again. Come back to the breath. So as you breathe in, let your tongue soften down towards your heart. Let your soft palate release up towards the crown of your head. Create that sensation like your eardrums are sinking in towards each other in the back of your throat. And as you breathe in, you can feel and maybe hear the sensation of your breath swirling in the back of your throat as it heads in, and maybe swirling in the back of your throat as you breathe out. So stay with this breath as this feels okay. Put your hands together. Just intertwine your fingers together like this. Palms are together. Put your arms up. Let your shoulders relax down away from the sky, sort of down onto the floor. And as you breathe in next time, in that way you're breathing, reach your arms up. And as you breathe out, let your arms come down. And just do that a few times. Breathe in, reach up. So you're still feeling that breath swirling around the back of your throat while you're reaching up gently, while you're drawing down to the just right spot. Great. And then let your arms come down, let your hands release. Just let your shoulders relax. Maybe again, shift your hips a bit, shift your shoulders a little bit. Bring your hands back together again. Palms are together. Elbows are coming towards straight. Lift your arms up towards the sky. And this time you're going to take them up over your head, but only as far as feels okay. So if you feel like this is enough, go to there, then bring your arms back down again. If taking your arms all the way over your head feels like the right thing to do today, so that your hands come back down all the way to the floor, go ahead and do that. But the idea is to keep your breath flowing as you do this. Find the right amount of effort, so not too much. If you run into any spots where you're feeling like that might be far enough to go, then keep your breath calm, keep your body calm. It's okay to nudge that spot. While you continue to breathe and keep your body calm, keep your mind calm. And then let your arms come down, let them rest again. Move your hips around just a little bit. This time we're going to get you to do just one more thing from this position. You're going to take your left ankle and you're going to put it on top of your right thigh, if that's okay, just to there. If you feel like you can't do that, the other option you have would be to put your foot over top of your other shin this way. If your hips are particularly tight, you could start there. Or you can bring your foot up to here. Take your left hand, put it on your left knee, and just gently push your knee away while you continue to feel the breath coming in and going out. Find the just right stretch around your hip and your lower back. Now, for those of you who have really nice movable hips, where your hips feel good and you like more stretch, what you could do is release this tension and bring your other leg up, hold onto the back of your thigh and pull this up toward your chest. If you're like me and your hips are tighter, this is the perfect place to be, where you can just push this way. I can feel a nice stretch here. I know that I can breathe this way and start to let the muscles release a bit if I stay here. So I'm sending a message with my thoughts. It's okay to let go. I'm creating that sensation of my breath swirling at the back of my throat and feeling the softness of my breath. It's helping to find a bit more softness in my body. Remember, you do not need to hold it this long. If it's not feeling like the right thing to do, pause. Don't wait for me. So if you are still there, uncross your legs, shift your hips around just a bit, and then we'll try the same thing on the other side. So cross the other foot or ankle on the thigh, put your right hand on your knee, and just gently push that hip away. If you start to feel your whole body going like this, maybe you're going a little bit too hard. So you can just push like that. Or remember, if your hips are more open and you want more stretch, you can put your hands behind the other thigh and pull that knee up. Some of you will be able to pull it up towards your chest even. So if you're here, hand on the thigh, just push until you feel a gentle stretch here. An effort that you know is going to work, that you'll be able to find some more softness here and stay with that breath. And remember, you don't have to wait for me. Pause when it feels like it's enough. The best thing to do is to pause when you feel like, if I stop now, I'm going to be all right. Now from here, you're going to make your way onto your belly. So I'm going to sit up. You don't need to. You could just roll over. I'm just going to sit up and shift myself to the other way for being on my belly. So you come onto your belly, put your hands underneath where you're going to put your head down on the floor like this. Now I'm going to keep my head up so that I can talk to you and my voice isn't all muffled from speaking into the floor. But your hands will be like this if you can. Push your palms down, put your forehead on your palms, and let your body relax there. You say, I'm going to stay up here. You could stay up here if you want to. So from this position, come back to that breath. Let your shoulders relax a bit. Come back to that sensation of the air swirling at the back of your throat on the way in and on the way out. And as you're doing that, just start to move your legs so you can bend your knee or your heel up towards your hips, put your leg back down, and then do the same thing on the other side, just back and forth. If it feels good to bend your knee while you're breathing in and let your leg go back down while you're breathing out, do that. Just bend that knee to just right spot, the spot that feels like that's okay. I know I'm not going to pay for this later. Now you can stay with doing this, or if you'd like a little bit more effort, what you can do is you can bend both knees. And if you bend both knees and you feel like that's the wrong effort, that's too much right now, then come back to just one. The idea is to move with your breath for right now. Now, the other option you have, of course, is always to pause if you want to, if that feels like it's enough. Or the other option you have would be to lift the straight leg. So if I was down like this and my head in the center, what I could do is I could lift the leg up off the floor this way and then lift the leg up off the floor this way. So I'm still feeling the air swirling at the back of my throat as I lift my leg up. As the leg comes up. Only up as far as feels okay. Just feeling a little bit of effort, letting the muscles relax when my leg comes back down again. Right, so let your legs pause now if you haven't already, and shift your hips around a little bit. If it would feel good to come up onto your elbows, then come on up onto your elbows, or you can stay flat down there for a moment. Just shift your hips around a little bit. Now the next step is to come up onto your elbows. If you're not here, come on up. And so see if you can put your forearms down on the floor. Your elbows are pretty much underneath your shoulders. You're not like this, so your shoulders aren't up like that. They're sort of down, and you can feel a gentle back bend. Now, for those of you who know that back bending is just not is going to provoke things too much, then stay on down on the floor for right now, and you can imagine this next movement. So from this movement, from here, what I'm going to get you to do is to lift your head straight to the center, and then relax it back down again. And lift your head straight to the center, pull your shoulder blades back down your back a bit, then come on back down again. So you're not trying to push your head way back really hard. You're not really trying to arch your back really far. You're just coming up to that just right spot. And if you've done 2 or 3 of these and you feel like it's already enough, then pause there, stop there. And if you pause, what you can do is just come on back down, put your head down on your hands again, and find some release there. So if you're still moving, come on back down, shift your hips around a little bit. This time, put your hands underneath your shoulders. I'm going to get you to push up onto your hands and knees. Now, we're going to do a couple things from your hands and knees. I'm going to turn a little bit this way so you can see it. But while you're doing this, that blanket that you had close by, maybe you want to use it for your knees, so you can put it down on the mat. And so you're kneeling on the mat, that can give you a nice cushion there if that's what you want or need. You can also do the same thing for your wrists. So if you find that your wrists don't like to be bent back so far, you could put this down in front of you, put your hands, just the heels of your hands at the edge, and let your fingers relax down. And so you can see that doesn't pull my wrist back quite so far. I'm going to leave this here underneath my hands because I like it here. So from this position, you can see I've got sort of a long spine. My shoulders are down away from my neck. The very first thing I'd like you to do is to come back to that same breath again. Feel the tongue sinking down towards the heart, soft palate, releasing up towards the crown of the head, inner ears sinking in towards the center. Slow down your breath and feel the air swirling there. Now I'm just going to start to move your spine a bit. So what I'd like you to do is bring your chin down towards your chest, tuck your tail under and round your back a bit this way, and then go the opposite direction, either back just in neutral, or if it would feel good to come up into a sort of a back bend from here, like you're lifting your tail up, lifting your head up, pulling your shoulders back, or like I said, just come back to neutral. So your chin comes towards your chest, your tail tucks under, either come back to neutral and then go back into this, or you can go past neutral and come into a bit of a back bend. However you're doing it, do it with your breath and only go so far that it feels like that's okay. It's an okay movement. And maybe you've done a few and you're saying that's enough already. So if it is enough already, a few options, you can lay right back down on the floor. Or if your knees are okay with it, you come back into a kneeling position and pause and take the weight off your shoulders and neck. Or lay down in any position you want to if it's time to take a break. So if you're still going there, you've got that roundness of the back, and then either back to neutral or coming into that back bend while you do the breath in and out. Now, if any time you need to give your wrists a break, you can pause and come on up and just circle your hands around, shift your shoulders around. If you haven't been here for a while, this might be time to say, that's enough, I'm going to lay down my back. If you're doing okay, we're just going to do one more set of movements here. So your hands are on the floor, you feel your shoulders come back, you've got that breath flowing back and forth. And this time you're going to lift your arm up in front of you just to the right spot and bring it back down. Take the weight over on top of the other hand, take the arm up, bring it back down. Now do the breath and the movement so you feel that air swirling at the back of your throat as you do this. Breathing in as your arm comes up, breathing out as your arm comes down, if that feels like the right pattern to do. Remember, if you feel like this is enough already, pause, lay back down on your belly, lay back down on your back, come back onto your knees, whichever would feel okay. If you're doing okay, you can stay with this. It feels good to this movement to feel the effort in your shoulders, then carry on. If you'd like more challenge today, what you can do is lift up the opposite leg with that arm. So I'd be lifting up my right arm and lifting up my left leg and putting them back down. Now, if you haven't done this in a while, it takes a bit of balance, so take your time. And maybe the idea is just lift your hand up just a little bit and your leg up just a little bit. But if you're used to this, you can take your arm way up there and it feels good to do that effort. Go ahead. Breathe while you do it. However much you're lifting your arms up. Remember, you can pause anytime you want. You don't have to continue just because I'm still continuing. I'll just do one more each side here. Great. So then I'm going to come back down on my back again. Just going to fold that blanket up so it's going to go underneath my knees when I lay back down. Get my pillow again. So take your time. Do any stretch you want to on the way back down. So you can lay with your knees bent over top of that blanket or towel. Or if you prefer it, you can have your knees bent up like this. If you're okay with letting your legs relax there, let them relax, let them roll out just a little bit. Find that just right spot for your shoulders and neck. If this is the first time you've worked on this, maybe you'll find that next time you want to have a different height of a pillow. And sort of try to find the best place for now. Your neck is a bit long. Your arms can be resting here. What I'd like you to do, if it's okay with you, is to close your eyes and take your attention inward. This isn't time to go to sleep. This is time to be awake. This is time to notice. Now is the time to take your mind to that spot where you can notice what's happening in your body right now. If there's still effort in the muscles from these movements you've been doing, notice that. If there's still effort in your breath, if you're still breathing with that breath pattern that we have been working on, notice that. If there's pain or tension or discomfort in your body, just take a moment and take your attention there. Notice what's happening there now. If you want to smooth out your breath, go ahead and smooth out your breath. If you want to decrease some of the tension in your body, take your attention there, take your breath there, take your thoughts there. Find a way to release a bit. Notice what's happening in your thoughts right now. Maybe you're thinking about something that you tried today or something you want to try some more. Just notice whatever's happening. Notice whatever thoughts are there. Maybe it's thoughts of, hey, this is helping some, or thoughts of, I'm not sure this is really going to help. Notice whatever's going on. If there's any emotion, happiness, fear, anxiety, sadness, just notice it. Then one last time for today, come back to that breath. Feel the soft pellet releasing up towards the crown of the head. Feel your tongue relaxing down towards your heart. Create the sensation that your eardrums are sinking in towards each other. There's more space in the back of your throat. And as you breathe in, you can feel the air swirling back there. As you breathe out, you can feel the air swirl there. And maybe you can even hear it. So if by chance this feels like a really great place to stay, you can go ahead and stay there for a while. I know there's a poll that we'd like you to fill out, so maybe you need to get up a little bit and fill out that poll. And maybe after you filled out the poll, you could come back. This was starting to get you that place of relaxation, and you can come back here again at the end. But for now, we'll leave the movement practice and relaxation practice at that for today. Thanks.
Thank you, Neil. And thank you to all our participants. I almost, I don't really want to talk because that was so relaxing, Neil. I'm worried that everyone's in this really nice Zen space. And I hope you can stay there for a little while longer and just enjoy the feeling that you've created through this practice. Neil, we don't have any questions, so I think that's probably it for today, and we'll see you later this week. Thanks so much, and thanks to everyone who has come and continues to come. And this is amazing that you're taking the time to do this movement practice. It's terrific. So have a great week, everyone. Oh, hang on, we do have one question. Oh, just a thank you. All right, have a great week, everyone, and we will see you soon.